How is it that some diabetics are able to fight off infection in less than no time and get on with life, and then there are those other diabetics who end up with an infection that's so severe they have to be admitted to the hospital, where they might languish for days, weeks, and sometimes even months, wondering, why me? Well, in today's video, I am going to explain to you one of the big reasons, in my opinion, that explains why some diabetics end up with severe infections in the hospital. There are many reasons, of course, many possible reasons, but one is basically a difference in eating habits. And to illustrate that difference, I am going to share with you 5 forbidden foods that I found in the hospital rooms of my diabetic patients over the past month or so. Before I get into it quickly, I'm Dr. Amina, Goodwin, a physician and a health coach, and I help people with high blood sugar levels get those blood sugar levels back to normal so that they can enjoy their life in a healthy way without having to take more medications. By the way, I also kill bad bugs in the hospital. And so any of you listening who is diabetic, you really gonna want to listen to the end, because listening to this video will help you not come into the hospital and end up with a doctor like me, an infectious disease specialist, trying to get rid of your infection. All right, before we get into the 5 forbidden foods, let me explain to you how, because this is a question I've answered a lot over the past 4 weeks as well. How on earth can you tell that a food has too much sugar? All right, well, the guidelines, general guidelines, according to the World Health Organization, this guideline has been out for over a decade now, I believe, but essentially this guideline states that added sugar intake, I'm not talking about sugars in general, I'm specifically talking about that sugar that you will add to whatever your food is. Added sugar intake should not be more than 24 grams in a 24-hour period. Now, what does that mean? 4 grams of sugar is equal to 1 teaspoon. So for you to appreciate how much sugar we're talking about for a 24-hour period, none of us should have more than 6 teaspoons of sugar in a 24-hour period. Okay, now 24 grams comes in handy. It's helpful to know that number, because when we're looking at packaged foods, that is what is going to be on the package label. At the back, you flip it over and you see that table, and usually you'll have a segment saying total carbohydrates, and then under that it says including added sugars X amount of grams. So it will say including added sugars 9 grams or including added sugars 14 grams. And essentially, of all the packaged foods that you eat in a 24-hour period, when you add up all those amounts of added sugar, it should not be more than 24 grams. If you're not eating packaged foods, but instead you're adding sugar to your tea or your coffee or your yogurt or whatever, you should keep a running tally and not exceed more than 6 teaspoons of added sugar in a 24-hour period. We use the word sugar loosely, usually thinking about table sugar, sucrose, but that actually refers to any sweetener, any caloric sweetener. So honey, agave nectar, maple syrup, all these things, for the most part, all these types of caloric sweeteners will increase your blood sugar or blood glucose levels in a similar fashion. And so it doesn't matter if it's the natural honey or maple syrup or it's the sucrose, for the most part, all these sugars should be, or sweeteners rather, should be no more than 6 teaspoons or 24 grams in a 24-hour period. So that's the first thing. And many people over the past couple of weeks, diabetics, have been shocked when I told them this number, because then after telling them that number, I start now identifying specific foods that they eat on a regular basis. Up to today, I was talking to a man about the fact that he told me he likes soda pop, and we were talking about the fact that 1 can of soda can have up to 10 teaspoons or more, but on average 10 teaspoons of sugar. And his eyes popped. He was like, what? Because then I said, yes, 1 soda has 10 teaspoons of sugar, but your intake per day should not be more than 6 teaspoons. And then he realized, oh, so I'm getting almost 1.5 times my daily intake from just 1 can of soda, right? And I'm having other forms of other amounts of added sugar as the day progresses. So he really started to realize how much or how significant his sugar intake was. And then he started to realize, oh, that is why my sugar is high. oh, that is why I'm needing more medications. And in his case, I'm actually treating an infection of his foot, right? So that's him. Now, what are some of these forbidden foods that I've seen or found in the rooms of my patients? Because, you know, these are people who are sick in the hospital, and these foods, they seem simple, little thing here, little thing there. What are these foods? The first one is Snickers. So this patient had a Snicker bar, and it was just there just as a snack, just in case. And it was a small Snicker bar, and she thought, well, you know, it's not a problem. But when we looked on the label of that Snicker bar, it had 20 grams of added sugar just in that one Snicker bar. Remember, 4 grams is equal to 1 teaspoon. So if you divide that 20 grams by 4, you see that that one Snicker bar has 5 teaspoons of added sugar. So that one bar takes away her whole day's allowance of sugar. But obviously that's not going to be the only thing she's having that has added sugar. So you can see how she will end up having way above the total daily allowance of 6 teaspoons or 24 grams in a day, because the Snicker is only one of many things that she's having with added sugar, okay? And she didn't realize, so we did some education, but education is, it's repetitive. It needs to be ongoing, right? And I think that's what we're lacking with so many of our patients and people in general. There's not that ongoing education to let you sort of get it, for it to click, okay? Second forbidden food I saw in one of the rooms of my patients, Raisin Bran. He said he was eating Raisin Bran cereal. It was good. And in fact, by the way, I'm not blaming anybody too, because these foods, like the Raisin Bran, was actually provided by the hospital. So it wasn't even the patient's fault. But anyway, Raisin Bran felt to be healthy because it has bran, it has fiber. But guess what? 1 cup of Raisin Bran has 9 grams of added sugar. It has 17 grams total of sugar. And you might think, oh, Raisin Bran, it has fiber, right? But it only has 7 grams of fiber, and of the total carbs, and I'm not talking total carbs now, but anyway, of the total carbs, it has 47 carbohydrates in total, only 7 grams fiber. So total net carbs is 40 grams, right? And then of that, you have 9 grams added sugar, which 9 divided by 4, that's 2 1/4. So from his Raisin Bran cereal, he was getting 2 teaspoons of sugar, which leaves only 4 teaspoons of sugar for the rest of the day. Now, he was having other sources of added sugar. We won't go there, but you get the point, right? 2 or 1/3 of his daily allowance just from that one little packet of Raisin Bran. And he's not even getting much in the way of collateral benefits from the Raisin Bran, because the amount of fiber he's getting is not that significant, okay? Third forbidden food I saw in one of my patient's room, a diabetic patient's room, was actually a liter of Pepsi. Now, granted, this young man said he was doing so much better now because there was a time when he was drinking 4 1-liter bottles of Pepsi per day. He admitted it. He said he was addicted to Pepsi, but he was able to come all the way down to 1-liter bottle of Pepsi. We looked at the bottle and saw that 1 serving, and in fact, he brought this to my attention, 1 serving had 41 grams of sugar. Right? So I said, do you know how much sugar is in 1 serving of this? And he didn't realize. So I brought it to his attention, 41 grams of sugar in 1 serving. He's like, yeah, and that bottle has 2 servings. So he noticed it, because that's another thing that many people don't notice. They don't realize that they need to check the serving size, right? So 41 grams of sugar, let's call it 40, divide that by 4, right, grams, and you get 10 teaspoons. 10 teaspoons of sugar in half a bottle, 1 serving. And he was drinking 4 bottles. So in a whole bottle, he was getting 20 teaspoons of sugar. And then when we did the calculation, 4 bottles per day, he was getting 80 teaspoons of sugar per day, added sugar, just from Pepsi alone. He was having other things, many other things, in fact, with added sugar, right? Now, he was down to 1 liter, but still he was in hospital with an infection of his ankle joint. And so pouring fat to fire almost, because sugar is food for germs, bacteria, fungus, all these germs, they thrive on sugar. And so he is getting 20 grams of sugar, 20 teaspoons of added sugar from a whole bottle of Pepsi Cola going into his body. And it's no surprise really to me. It's a surprise to maybe you, but it's no surprise to me that he would have been in hospital with this infection, right? So that's the third thing. The fourth one is apple juice. Now, apple juice used to be one of my favorites when I was still a sugar addict, right? Nice, sweet, tart to flavor at the same time. And so I had this patient, and he has a foot infection. In fact, sadly, he's going to have an amputation of his foot because the infection is just not healing. It's been there for 1.5 years. And he was taking half a cup of apple juice, not a whole cup, half a cup, because one of the medicines he was taking, he needed to dilute it. It didn't taste good, so he always drinks it with apple juice. And so I went over with him the fact that a half a cup of apple juice has 12 grams of sugar. 12 grams of sugar, 12 divided by 4, that's 3 teaspoons. Now you will say, and I agree, that, oh, that's not added sugar, that's naturally occurring sugar. 100% fruit juice, naturally occurring sugar. Even though it's naturally occurring sugar, it's an unnaturally concentrated form of sugar, because ordinarily we're not going to drink we're not going to eat the number of apples it takes to make a cup of apple juice. And furthermore, if we're eating apples, we will get some fiber from the skin and from the flesh of the apple itself, and water and so on and so forth. Apple juice is an unnaturally concentrated form of sugar. If you look at the ingredients, oftentimes it will say apple juice from concentrate, and then they add water. And oftentimes when they dilute it, it doesn't come to the dilution that it would be if it was freshly juiced from the apple, okay? So an unnaturally concentrated form of sugar, an unnaturally high amount of sugar in one go, 3 teaspoons in one go, right? So that's kind of a little variation from added sugar versus the naturally containing sugar, but it's an important distinction because, again, it's an unnaturally concentrated form of sugar that you're getting from that half cup of apple juice, right? And then the last forbidden food I saw in the room of my patient, one of my patients, another patient, and this is an unfortunate thing with her because she's having an infection in her belly. Like, she went in for a routine gynecologic procedure, and unfortunately, excuse me, because of, obesity and some of the complications related to being overweight, she got an infection. But sadly, as a little snack, for the middle of the night, just in case, right, her snack, unfortunately, was M&Ms. And when we look at that packet of M&Ms, it essentially has 23 grams of added sugar. Let's call it 24. 24 divided by 4, that's 6 teaspoons of added sugar just from one little packet of M&Ms. Who is going to eat one single M&M or 2 or 3 or 4 M&Ms? No, these things are made to taste very good, and you will eat the whole pack in less than no time. And that is what's going to cause blood sugar to go up. That is what's going to feed the infection, the germs, the bacteria, the fungus, and so on. That's driving this infection, right? So these are just examples of forbidden foods that I have found in the rooms of my diabetic patients. Oftentimes small quantities, but they pack quite a big punch when it comes to the amount of sugar, and essentially cause the person to reach the limit of added sugar intake for a 24-hour period, which again is 6 teaspoons of added sugar per 24-hour period, or 24 grams of added sugar per 24-hour period, because every 4 grams of sugar is equal to 1 teaspoon. Those 5 forbidden foods I've found in the rooms of my patients just over the past few weeks, right? Snickers, Raisin Bran, Pepsi, apple juice, and M&Ms, right? So listen to this video again. Start looking at your labels. You just have to. You cannot assume that the amount of sugar is a safe level of sugar. These recommendations are for everyone. I use them for the diabetic patients I have as well, because I think it's almost impossible to get to 0 sugar. But if you're having 80 teaspoons of sugar, like my young man with ankle infection, at least 6 teaspoons. I can't tell him 0, right? So he cut down from 4 bottles of Pepsi down to 1 bottle, and maybe eventually he will get down to that 6 teaspoon or 24 gram per day limit of added sugar. I hope you all found this video helpful, and if you did, do share it with somebody else who you think will benefit from this very vital, crucial information. Take care, and I will see you on the next video. Bye.